All right, and welcome back from the break. Last week, there was an International Day celebration for the cancer. And celebrating cancer and keeping people back into the cancer awareness, as many people have survived cancer, many are fighting cancer, and others are still trying as much as they can to fight it, as others are healing of cancer. Meanwhile, the National Cancer Control Plan is considering establishing regional cancer centers worth 144 billion Ugandan shillings. The Uganda Cancer Institute say that the cancer patients face various challenges due to poor socioeconomic status and inefficiencies in the healthcare system and infrastructure. They said that some Ugandans lack enough money for transport to come to cancer institutes for medical attention, saying that the National Cancer Control Plan, they say that some Ugandans lack enough money for transport to come to the Cancer Institute for medication. And then the National Cancer Control is planning and considering establishing regional cancer centers, and these would cost a sum of 144 billion Ugandan shillings. Pedison Mumbere has more of the details.
Uganda Cancer Institute, the only comprehensive cancer treatment center in Uganda, registers about 33,000 to 34,000 new cancer patients every year. However, many cancer patients in Uganda never receive treatment due to a variety of challenges.
Every year there are about 10 million people that die from cancer worldwide, and it is estimated that 70% of the people that die from cancer are in low and middle income countries. And estimates suggest that by 2030, this number of people dying from cancer every year will have increased to 13 million. So it's a challenge that we have to deal with. The burden of cancer is increasing, the number of people dying from cancer is increasing worldwide, so we have to develop strategies to reduce the burden of cancer and prevent premature death from cancer in our country. In Uganda, like Dr. Mugisha said, we have every year between 33,000 and 34,000 new cases or new patients with cancer every year. 33,000, 34,000. Of these 33,000, only 7,400 make it for care at the Uganda Cancer Institute.
According to Dr. Nixon Niyonzima, Laboratory Director at Mulago Hospital, cancer patients face various challenges due to poor socioeconomic status, and that can't enable them to travel from their respective districts to the Cancer Institute in Kampala, and others tend to develop fear to come for treatment.
The fact is, of course, in many parts of this country, women are not economically empowered, so they are not able to get the transport to come for care or get funds to pay for care. And that's how gender actually affects care. But men are not spared either. Prostate cancer is the third commonest cancer in Uganda. Men are afraid to actually get treatment, one, because there's sexuality issues related to seeking care for prostate cancer. We have one of the treatment modalities being castration, either medical or surgical, meaning that the sexual prowess is actually affected. What that means is that many men will not want to come for care because of these challenges. So it's upon us as the media fraternity, but also as the healthcare workers on this side, to sensitize the population and enable people to access care.
Challenges faced by cancer patients in Uganda result in numerous delays in initiation and continuation of cancer treatment. These challenges are often as a result of poor socioeconomic status of some patients, inadequate infrastructure for cancer care, and inefficiency in the health care system. However, officials from the Cancer Institute of Uganda said that government has continued to allocate funds to improve the institution.
These drugs are expensive on the open market. And what we're doing is actually a multi-pronged approach to reduce the cost of cancer care for our patients. One, we are lobbying the government to increase funding for cancer medications, and the budget for cancer drugs has also increased over the past 3 years. And we thank Parliament and the government actually for supporting this. But we're also partnering with actually the manufacturers of the drugs. And we have several access programs. The access programs provide the drugs at a subsidized price for our country. And this only happens because you're buying in bulk. So we've partnered with a number of drug manufacturers to reduce the price. And also government has increased funding to reduce that, to really offset what patients are paying out of pocket for cancer drugs. So,
although most cancer services are provided free of charge, many cancer patients in Uganda are never referred. Many never seek treatment and hence face many challenges along their cancer journey. Nixon said that the government has allocated more funds to purchase radiotherapies on top of the one that the government of Uganda had, which even broke down.
Issues that we have, and also increase the understanding of the cancers in Uganda. Radiotherapy has been a big issue in the media. In 2016, we had one radiotherapy machine that broke down and caused a lot of uproar. But currently, we have 3 functioning radiotherapy machines at the Uganda Cancer Institute. And we have received funding this financial year from the government of Uganda to buy 2 additional machines. So by the end of June this year, we'll have 5 functioning machines. And these are high-end machines at the Uganda Cancer Institute. And this, we think, is going to address some of the challenges in access to radiotherapy services for our cancer patients.
The public health service structure in Uganda is organized in several levels, from health center 3 to district hospitals, regional and 2 national referral hospitals. Says there is no organized cancer screening programs in Uganda. Most cancer patients enter the core path of self-referral due to alarming symptoms. However, Dr. Mugisha Noleb, head of cancer prevention, says that prevention is better than cure.
Should abstain until when they get married. And if for any reason they choose to be sexually active, they should stick to that partner alone. But it's hard. You know, it's very hard when somebody is not married to have one single sexual partner. So we recommend that we should all abstain until when we get married. And when we get married, we stick to our sexual partner. That way, we will minimize the chances of acquiring the human papilloma virus that is a high risk for cancer of the cervix, but it's also a high risk for cancer of the penis. This week, on Monday, I had a gentleman with cancer of the penis. And you don't want to see anyone suffering from cancer of the penis. And the best way to avoid it is this, careless sexual behavior, as I usually call it.
Cancer is a growing problem in Uganda. Cancer affects any part of the body. There are different types of cancers due to the different risk factors. Cancer can affect anybody, but this is influenced by one's behavior or exposure to risky conditions or environment. Bedson Mumbere, Smart 24 TV.
And among the challenges that are often result from poor socioeconomic status of the patients include inadequate infrastructure for cancer care. There is also inefficiencies in the health care systems. Let's sum up this discussion by bringing it in a holistic approach for all the health.
Holistic.
Holistic for
Okay.
for the health sector in Uganda mainly. So when you look at that, do you feel that these are also some of the challenges most of our patients face in Uganda here?
Yeah, because when you look at the cases prevailing with the cancer, related to cancer issues that have always been reported around the country, from the experience I have encountered with some of the patients, it comes with a lot of fear. When you discover you've got cancer, there is fear that comes into you, and the people that actually are around you, they fear a lot that maybe you're going to die, maybe that's the end of life. At some point there is a lot of fear, and also associated with the treatment around the country, around here, because there are speculations that when you get cancer, you are bound actually to live with it forever around here. And actually that's false, according to the report from Ministry of Health, and also the facilities, for example, at Mulago. And now the government is actually implementing more the devices for cancer screening and all that. So you can have the right information. It's the only saver actually of your life. When you have, if you're a cancer patient or any chronic diseases or any severe really diseases, what saves you at some point when even you are dying on bed is having the right people around you and having the correct information. Because someone is going to tell you, so you're not leaving for the next month actually. But again, we have had people who are sharing stories that they had cancer, they had diabetes, maybe it was projected for less than a month they will be leaving, and now they have lived even for more than 5 years. So to me is how you able to take in the information. And then when we look at back to the healthcare facilities and how the health services around the country are undertaking the cancer services and also treating people and making sure that Ugandans get at least adequately effective implemented healthcare regarding cancer, it's still fair.
Also, and when you look at the fact that people are fighting cancer, it is a positive for almost everyone out there who's suffering from cancer. Not only cancer, we have people who are suffering from different chronic diseases, others facing sexually transmitted diseases. Most of these people suffering, most of them, no, it's somehow. So when you look at that, then
so it's sexually transmitted diseases, via one. Is it really so much hard?
No, it checks why, because
to worry that I'm going to die because of an STD.
What happens is the stigma. Unlike with cancer, there are very few cases regarding stigmatization on the side of the cancer patients, because people are willing to welcome them in society. Others are willing to support them. Most when someone realizes that this person has cancer, maybe this cancer are welcoming. But when you look at the other scenarios of maybe sexually transmitted diseases, like I was saying, people with AIDS, people with maybe gonorrhea, all that, people tend to distance themselves away from these people. They discriminate, and then that stigma pushes most of these people to isolate themselves and feel depressed at the end of the day. So when we're looking at even the cancer awareness, I think it takes us back to how welcoming are we when we meet these patients or anyone suffering from a certain disease, let it be cancer, because the more hospitable we are towards these people, is going to help them in the healing process. It may not completely heal.
STD, honestly, I don't want to judge that that's you're bringing to yourself, but you should always take good care of yourself. I mean, this information is always there. The Ministry of Health is always trying at least to run advertisements on various media campaigns, and even people tell you on your radios, even on your televisions, that hey, maybe you can use a protection, you can try to use this and this for you to be very protective. And also the good one is abstinence, in case you're not yet there. Why we're talking about this is actually on a day where we bring, this is a general desk where we bring to you business desk as our theme. So we tackle social concerns that are affecting a lot of communities around there. So for me, that's it. Can you protect yourself always? Because this information is always going to be there, Sonko. And government is always going to tell you, put on your mask, distance, but it's not going to hold your hand, Sonko, come here, let us social distance together. No, it's you from your heart to implement.
And also, speaking of the cancer situation here, the National Cancer Control Plan, is considering establishing regional cancer centers. This will cost 144 billion. And when you look at the regional cancer centers, what they want to do is create regions or hospitals whereby cancer patients can
designated
go
for that. That would be good, because it has not been there.
Because the challenge they are facing is that most of the cancer patients have to actually travel from up country, moving to the Baje, yes, in Mulago, in Kampala, to seek for that. And the time when you come, maybe you find more patients still, so it becomes very difficult to treat and to help these people. So that is why in most they have actually thought it wise that they would need to establish regional cancer centers.
That's kudos to COVID-19. COVID-19 has made us learn a lot of situations and a lot on how we can handle our health care and improve it. Because take a scenario where a COVID-19 patient would not have to travel from Chenjojo, my district, to come to Mulago. Government had to allies medical facilities, emergency centers, and this is what they are doing. To me, I mean, it's a lesson we have learned from COVID-19. If it were not for COVID, we would still be living without any emergency care facilities on our nearby hospitals, on our nearby health services. So, I mean, take a look on the years on how we've been living. You get severely sick, you have to analyze either in the night, in the middle of the night, you have to find means to come to Mulago Hospital, that is in the capital city around Kampala. And because the facility is not where you stay, in Fort Portal, in Buikwe, in wherever district you are, but this government move is bound to make actually a great improvement with our healthcare system.
And furthermore, the Uganda Cancer Institute is the only comprehensive cancer treatment center in Uganda, and it registers about 33,000 to 34,000 new cancer patients every year. You can imagine that quite a very huge number. However, many cancer patients in Uganda never receive treatment due to a variety of challenges, one of which is we only have one treatment center. And so with these numbers, then we expect these numbers to continuously go, because by the way, I really worry about cancer, mainly because everything on your body can have cancer. Today you're listening, someone telling you I have hair cancer, the other one tells you I have nail cancer, I have skin cancer. So cancer is something that hits you without hair cancer and all the type of cancer. So out there, and God forbid we can, God forbid, none of us gets
I
that.
don't wish any one of you watching us to have hair cancer, to have any cancer around you. But always, like I said earlier, can you always digest in the right information? Because there are reasons as to why. There is a chronic cancer, chronic diabetes, pressure, but also there are things we do that bring about, you know, to make us receive or get sick. So make sure you're always digesting into the right information, and try to be away from peer pressure that will always bring to you diseases, because you're going to make up yourself in a very non-anti-skin of yours, and you put a makeup on your skin with something that does not match your skin actually. That is just one way to get cancer. So always be careful.
And we also do hope that if the government is considering of setting up these cancer institutes and cancer hospitals, regional cancer centers, we hope that government can also look into a situation whereby we need more hospitals in regional, or more supplies
but
to
also
the regional
let the
hospitals.
service be there. There is putting a machine, never take out each machine.
Spoken
bird, each machine. A machine. I'm meaning a machine to treat
big
cancer.
Machine.
Yes, and then after that, there is no doctor designated for that, or there is no surgeon, or there is no anybody to take care of that. So let even the labor be there, and let the Ministry of Health make sure that the people designated for that institute be there in time and be ready to receive people. That is it for me.
All right, and as a matter of fact, as we are summing up with today's show, we will definitely be keeping up on such matters. Like I said, we shall be having a feature story regarding grains, maize grains in the country, and also human trafficking. A number of the feature stories that are coming up on Smart 24. And
you should surely look out for them. And catch me up on social media platforms at Rita Cavaniero. And in case you appreciate my look, you can always get that at Galilea Plaza, level 7, room 511. Hafi will be there, and Mulongo Portable to make you look the same. Thank you.
Mulongo Portable. Anyway, that aside, the baby mama made sure that we look this great for the show, kickstarting up your week. Officially for the border borders, I hope I will get myself a border. And we hope that you will not overcharge the Ugandans, depending on the fact that now you're free to move and loiter throughout the night. That aside, you can catch me up on social media, Joram Paul Sonko on Twitter, Facebook, and Instagram. It is Smart24 TV, Facebook, Twitter, and Instagram. And coming up after the break is Yugi Tukole, with the engineer himself, Fred Makubia, taking you through